Yeah. So usually when you are managing, you are focusing on the symptoms. That's one. Okay. You are focusing on supporting the patient's recover. And three, you are focusing on a definitive management directed towards the organism. And that's why your culture is important. So your symptomatic management, you want to take care of the patient's high temperatures, right? So your IV paracetamol will sort you out there, right? Supportive, if your patient is breathless because of meningitis, you need to give oxygen, right? So, I mean, you are supporting the patient to recover faster. You need to give IV fluids if there's any form of septic shock and all that. You still want to keep the kidney and the other organs perfused. So you're giving your IV fluids. If there's a seizure, you need to abort the seizure. So your diazepam, your anti-seizure medications, because the more your patient has the seizure, the worse the prognosis is, because the patient can have one seizure and might not return again. So yes, you give the same antibiotic, all right, whilst you are waiting for your culture and sensitivity, but then you need to manage the other things supportively, right? You give those other things. So you combine your antibiotic with some anti-seizure medication. Okay.
Okay. Thank you.
You're welcome. And you always make sure you are nursing in a relatively darker room, because we said photophobia. So when the lights, once your light is too bright, then your patient's symptoms will get worse. Okay. What other disease would you also want to nurse in a darker room apart from meningitis?
Tetanus.
Good. Excellent. Tetanus. Okay. Yeah. Because you don't want to your patient to have. You wanted to.
I wanted to say epilepsy.
Yes, tetanus. Because you don't want your patient to have opisthotonus. Opisthotonus. Yeah.
What of snake bite?
Oh, snake bite.
Dog bite rather. Dog bite.
Dog bite, yeah.
Not good.
He likes snakes. He likes snakes. I see you eat snakes.
Oh. Snake bites, but Charlie.
Not necessarily. It's not like
snake on bite.
It's not like your usual. It's not like tetanus where they have photophobia. Okay, but dog bites, you are more worried about the patient's breathing and all that when they start salivating and all that. When the dog bite leads to some form of rabies, then 99.9% of the time they won't make it. But that one, you don't really worry about bright lights. It's more for tetanus and meningitis. Yes, Elijah.
Yeah, Doc.
Yes, please.
Doc, I want to find out about doing the lumbar puncture to confirm meningitis.
Yeah.
If a patient is suffering from hydrocephalus and you suspect that if you do the tapping, probably there will be coning forming.
They'll cone.
Is there any alternative? Alternative way to?
Yeah. So that's a good question. So if there's hydrocephalus or raised intracranial pressure, you have no business going to tap. Usually, if you want to tap CSF, ideally you have to check to be sure there's no raised intracranial pressure. Hydrocephalus is not so common in adults. This is adult meningitis. But before you tap for a child, for an adult, you need to be sure there's no raised intracranial pressure. Clearly, if there's hydrocephalus, you don't need to go further. It tells you that the intracranial pressure is likely to be raised. For an adult patient where you can't be too sure, you have to do what we call a Phandoscopy. You look at the back of the eye. If there's raised intracranial pressure, you are going to see what we call papillary edema. Okay, and I'll try and send a picture on your page so you try and remind me. Ideally, at the back of the eye, you have what we call a neuroretinal rim. So you have a very round, small, nice round structure in the middle. When you do a fundoscopy and you look at the back of the eye, there's a small round, like a bright light there. Once the intracranial pressure increases, this small round area of bright light starts expanding to the periphery of the large round retina you are looking at. And once it gets to the edge, you say you have papillary edema. It means there's a raised intracranial pressure, and you can only see that when you do a Phandoscopy. Once you check and there's papillary edema, it's a sign of raised intracranial pressure. You don't do a lumbar puncture, because once you do and you tap the fluid comes down with such a pressure that your brain matter would be forced to come down. And when it comes down, it can come through the foramen magnum, which is under your skull, the base of the skull. It forces the brain through the foramen magnum, and then you can have what we call coning. And because the brainstem is where your respiratory system and everything is, once it cones, you have a respiratory distress, and then you die. So you went in to tap to help diagnose, but then you've killed your patient. So we need to be always careful before we tap CSF. Okay.
Okay, thank you.
You're welcome. So try and go over the slides. There's a last lecture on enteric fever, but won't discuss that now, because some of you're already coming back from a lecture. I'm sure you're tired. I don't want a situation whereby you go see and then comes out. So if you are able to schedule a 40-minute Zoom lecture with me within the week, we can finish it. If you are not able to schedule, then you read through your enteric fever. If you are not able to schedule, then it means you won't get a written question on enteric fever. However, you will get MCQs on enteric fever. So if you read through the slide, you get like some 5 MCQs from enteric fever. If we go through as a class, then there's a possibility that it will pop up in your session B. But if we don't go through and you are reading on your own, you are reading on your all the topics, all the topics we've done in class.
I just died.
Will feature in your exam. You have 25 questions on cardio MCQs. Then you have 25 questions. Then you have 25 questions on respiratory. That makes it 50.
50.
Then you have 10 questions on the liver. So hepatitis, chronic liver disease, all that. So you have 10 questions there. So that makes it 60. You are going to have 10 questions on infectious diseases. That makes it what? 70. Then you have 10 questions on anemia and all that, hematology. I've taught you. So you have all the questions on sickle cell, anemia, 10 questions on that. That makes it what? 80. Then you are going to have 20 questions on therapeutics. All the topics, cardio and all that, I'm not going to ask you what medication is used for this. I'll ask you, by your 20 questions on therapeutics, like you can see that in management of asthma, which of the following medication is not given? That is therapeutics. You see it. In atrial fibrillation, which medication is given? You get 20 of such questions. That is therapeutics. So it means every part of your thing is important. And then
the question.
You are going to have 25 questions on cardio, 25 questions on respiratory. And if I say cardio, DVT, PE will feature. So 25
So
questions
you
on.
you said 20, now you are saying 25. Which is
Oh,
or the
I
more
said
we ask, the more
25.
you
Oh.
need.
No, he said
I said
25.
I said
He
25.
said 25.
Oh,
And then on pulmonary, 25.
good. And then 10 liver, 10 infectious disease. Infectious disease, I'll give you slides on COVID within the week. You'll get it. You get questions on COVID vaccines and all that. You get it. So please know your COVID vaccines. Know which one is mRNA vaccine. Know which one you take one dose. Know which one, know all those things. Because you're supposed to know. You see. So you get question on COVID for your infection. So 10 questions for infectious disease. You get some enteric fever questions. You get meningitis. You get COVID. You get viral hepatitis. We've done only 4 infectious disease, so you get questions on that. So maybe you can get 3 B, or maybe you can get 1 and the COVID you get 5. I mean, COVID is COVID. So then you get question on therapeutics 20. Then your written, you are going to get 5 questions. You get 1 question from cardio. Okay. The cardio focus on either heart failure, acute coronary syndrome, or hypertension on cardio for your written. Focus on heart failure, acute coronary syndrome, or hypertension for cardio.
Okay.
For respiratory, focus on pneumonia, or TB.
Okay.
For respiratory, focus on pneumonia or TB.
Okay.
Then for the liver, we are going to get a question on the liver. So for the liver, focus on chronic liver disease. Focus on chronic liver disease for the liver. So focus on complications of chronic liver disease. Okay. We've done that today. So focus on it. So 3 questions. We've done 3 questions.
Yeah.
Yes, 3.
Okay. And then your 4th question, you are going to get infectious diseases. For your infectious disease, focus on viral hepatitis, meaning that you can get a question with a viral profile and I'll tell you to interpret and manage. Or a question on meningitis, or a question on COVID-19 acute respiratory syndrome.
Okay.
If you guys don't get a question on COVID, your seniors will get a question on COVID. One person has to get a question on COVID.
So give it to our seniors.
Then then
their bones are stronger.
Then this one is bonus. So you get a question on sickle cell disease. So please read. For hematology, you get a question. I'll give you different. You just get a question on sickle cell. So learn about sickle cell crisis and how to manage sickle cell. I've given you all the Paul.
Yes,
So
okay. Okay, sir.
All right. So all the best. So if you are able to organize a class, then it means enteric fever will become a likely candidate for number 4. But if not, enteric fever will feature in your MCQs. So enjoy your evening.
Then say, if anything, let's postpone the exams and then work on the enteric fever.
No.
Hey, Ishmael.
Because automatically the questions will come under it.
So discuss as a class and let's know what dates we are writing the exams. Let's all agree.
No, we are postponing
Vacation days.
Oh,
in advance. In advance, rejecting.
So
Not
do have a
to make a
pleasant
decision.
evening.
Won't go film. What's Wednesday?
Discuss it.
Dr. Minta,
thing. So when you're taking feedback, when you're writing on the paper on the same day.
Charlie, see, this
All
is
right.
not where to take that decision.
Okay.
Finish the class.
So do have a blessed evening, and then
Sir.
hopefully we'll meet during exams. Yes, please.
Sir, my question last, I asked why with the HBS, they release more oxygen than the normal HB.
Oh, yeah. So
Ask questions.
it's called the oxygen dissociation curve. When you look at the oxygen dissociation curve, so go and read on what we call Bohr's effect.
Yes,
Okay.
This one is by the way. So I'll ask you in the exam, but
Okay.
read on what we call BOHR, Bohr's effect. BOHR, right? When you read on Bohr's effect, you would understand the reason why it's so. It's an adaptation so that you don't bind to, because if you bind oxygen strongly to hemoglobin and you don't release it readily, then the tissues will suffer. So for someone who has sickle cell, they are adapted in such a way that they bind and then they are able to release easily. Okay. Yeah.
Thank
so you read on Bohr's effect, you understand it more, because what all we want to say is that when the field changes and the field becomes more acidic, we need you to deliver more oxygen. And that's what happens in sickle cell. Because of the poor perfusion, you have acidosis sort of. So then we need that the body will adapt and deliver more oxygen. So it will release oxygen easily. Okay.
Okay. Thank you.
You're welcome. You guys should make me proud. Enjoy your evening.
Okay, sir. Thanks so much for your time.
You're welcome.
We are proud of you too. Bye-bye.
Bye.
Okay. Bye.